right. I hope you enjoy the video. So, now, until now, a few years ago, the power of astaxanthin were focusing on cellular oxidative stress, especially in the muscle, as we've been seeing in those seminars. So how astaxanthin works in the cellular membranes, in the transcription factors, in the mitochondria, antioxidant, anti-inflammatory, energy oxidation detox system. Now, with today's presentation, with all the other speakers, basically, we also have another aspect of astaxanthin, which we studied, we find out in the dogs, why those dogs are winning. We have a theory that is beyond the muscles. And it's a neurophysiological stress, basically a dysfunction of the cardiac autonomic system. So a different system that we play with what is called heart rate recovery. The heart rate recovery is the new research area for astaxanthin in endurance. Okay, so here. And so what we find, what is heart rate recovery? Basically, the time at which the heart rate declines from maximal exercise to resting levels. So as soon as you stop exercising, how fast is the recovery of the heart? So a faster heart rate recovery, it correlates with lower cardiovascular death, with endothelium dysfunction lower, with aerobic endurance, with better cardiorespiratory fitness, and prolonged anaerobic sprint. So basically, what the heart rate measures is the energy oxidation, oxygenation detox system, the efficiency basically of all the organs to support the muscle, and the brain, heart, muscle message system. Or even after today's discussion, we could also say the gut system as well. So we found out that we had an hypothesis. So this is a kind of heart rate recovery system, I would say. And you can say there is the parasympathetic nervous system. It down-regulate as we start to exercise and reach the maximum speed. And the sympathetic nervous system increase. This is called the flee-fight zone. Imagine that there is a lion running behind us. So basically, this is we switch to a flight-fight zone, and the heart rate goes up. And then there is a moment which is the free zone. The free zone, we just run away from the lions. We are behind the bushes, and so the heart rate doesn't go as fast down. And then finally, there is the recovery zone. So why the heart rate is important? Because the slower the heart rate in the first 2 minutes correlates with sudden cardiac death. Of course, in the jungle, maybe that's a good way to be ready. But in a human society, in a normal society, it's not a very efficient system. So we found out why the dogs are winning, why astaxanthin is good in athletes, because it facilitates heart rate recovery. So we developed an experiment that is very interesting. So we are experimenting with rats at this moment to check the heart rate recovery, the anaerobic threshold, and the sprint resilience. So what we did, we implanted a continuous heart rate monitoring device inside the mice. We make them run 85% endurance of their maximum speed for about 15 minutes. Then they have a break of 7 minutes. We check the heart rate as well, and other types of fitness check, and then they run another 85%. And then they have a final sprint of 100% anaerobic exercise. So we check how much is the lactic acids, how is the heart rate, okay? So they run, one break, last sprint, another break. Here the result. Okay, this is just another slide to show how the procedure is done. They take for 27 days, and then on the 28 days, they have the final race. I will show you later a video that nobody ever seen. Only maybe our president. Okay, so, and this is, the gray color is the control group, and the red color is astaxanthin. So you can see after 1 month, the resting heart rate goes down. The cardiac output during the 85% sprint is greater, which means better stroke volume, better blood flow, better cardiac contractility. And then something strange happened here. You can see in the control there is an abnormal heart rate recovery. So during the break time, the heart rate goes up, while with astaxanthin is optimal, is going down. And then we can see another interesting thing is here happening. You can see in this area, when they start to exercise, the heart rate goes down. That means they're already exhausted. But with astaxanthin goes well up, it performs well. So you can see here what is called cardiac hypoxia. Then we have exhaustion point or heart rate deflection point. You can see basically at this point the heart rate collapse. That's mean exhausted, game over. And with astaxanthin we can prolong the exhaustion point. That's mean the difference between winning and losing, between exhausting and keep going, what is called resilience. And then the heart rate, 27% faster, both in the parasympathetic and the sympathetic nervous system activation. 27% faster, that's huge. So that is really important element. Then here the muscle. Can you guess which is astaxanthin? Don't need a guess, right? So this is a weak and shrunk muscle. This is the quadriceps muscle after 20 days of exercise. They look with astaxanthin. But the tougher, bulkier muscle, more myoglobin in the muscle, enhance in oxidation and recovery during anaerobic exercise. So that is the difference. And how about the heart, since we are talking about the heart? So here is the heart. This is the astaxanthin heart here, and this is the control group. You can see lower cardiac integrity, depleted concentration of myoglobin protein, lack of oxygenation, recovery during aerobic conditioning, and then higher cardiac integrity from this side. So it's very self-explanatory in a way. Then what's next? At Astareal, we believe we're always constantly improving, looking for new solutions, events. So now our focus is anti-fatigue. That's something that always we try to beat ourselves. So breakthrough heart rate recovery formula for overcoming fatigue. So we try to rise the anaerobic threshold, which means basically the time that anaerobic system becomes overwhelmed and turn into anaerobic. And then rising the anaerobic resilience. How long can you run under pressure? Okay? So that is what we created, a new formulation. So this is a new formulation. I show you the video. So we can say this new formulation we created with, of course, with astaxanthin at the super basic one. We can see the resting heart rate is even lower with the same protocol, greater cardiac output. But what I want to show most of all is this point. You can see the control collapses here. Why this new formulation with anti-fatigue containing astaxanthin formulation never collapse. It's not doping, eh? Okay? So heart rate recovery drops down by 46%. I beat everybody. I challenge anybody to find a better formula than this. Not easy one. So since I am a practical person, I want to show you the video. So yeah, you can believe with your own eyes, because sometimes graphs doesn't count if you don't see with your eyes, okay? So stay tuned, coming soon. That is what new formulation is coming in. Improves heart rate recovery, inhibits cardiac deflection point, optimize cardiac autonomic functioning, and all of those elements, includes explosive power, anaerobic threshold, sprinting force under extreme endurance. So let me show you this video. Astaxanthin power formula. Control, astaxanthin only. Final sprint. right. Stop it, like that. Thank you very much. I hope you enjoyed the presentation. Grazie.
Thank you very much, Dr. Nalducci. Thank you very much for your remarkable presentation that astaxanthin may stimulate brain, heart, muscle, neurocommunication system that solve our fatigue. Thank you very much. We're looking forward to hearing new research from you soon, pretty soon. Thank you.
Now we would like to start session 1 on the latest research. We have a latest research reports. Session 1 is moderated by Dr. Professor Ryuichi Morishita from Osaka University School of Medicine. He studied at the Stanford Universities after graduation. His specialty is cardiovascular diseases, genetic therapy, gerontology, and he also serves at the various panels of the national government and prefectural government as an advisor of health longevity. Dr. Morishita, please. And the speaker is from Kyoto University, Department of Otolaryngology. Dr. Hirano is our speaker. 1990, he graduated from the School of Medicine, and then he eventually served at Kyoto University as an ENT doctor, and also he studied at the various schools in the United States, and he has now obtained a professorship at the Kyoto University. Congratulations. And the protective effects of astaxanthin on the vocal folds injury is his topic. Thank you very much for your kind introduction. My topic is slightly different from the previous speakers, but this is a substance good for voice. And I have extensive study on the protective effect of astaxanthin on the vocal folds. And Dr. Kaneko, speech therapist, also assisted this particular experiment and the research. And this is the vocal folds. And it's 100 to 800 vibrations per second. So you need a high-speed camera to capture the moment. And overuse or abuse of the voice may induce so much oxidative stress you can imagine. So you may have deteriorating voice, vocal abusers, and professional voice users such as singers. This is an instrument, like musical instrument, but overuse and abuse may gives hoarseness and limited voice range, pitch, loudness, and voicing periods, and vocal fatigue. And sometimes you can no longer sing. And the vocal folds must be maintained, so to speak, properly. So you should refrain from vocal abuse, misuse, inflammation, chemical inhalation, tobacco chemicals, and marijuana heats, and direct injuries such as vocal fold surgery. If you miss any of the points, you may lose your voice. And the worst thing you have to think is scarring. This is hardly a voice. You cannot speak properly. Phonation is damaged. And with aging, it may also happen to some individuals. This is an elderly patient, thin, frail patient, and thin, frail vocal folds. So this is what you have to avoid. This is 1 millimeter thick mucosa, and it has 3 proper layers. If you lose this structure, you end up with a scar. This is a dense collagen as a scar, so to speak. And the wound healing has only 2 fates, regeneration or scarring. And scarring you would like to avoid. So you have to discuss ROS, reactive oxygen species. Loss protects injury from bacteria. However, too much loss and exposure causes worse wound healing. It has been proven. What about vocal folds and wound healing? This is a rat model, and this is 1 millimeter long rat vocal fold mucosa. You split with scissors and see what happens. Control on the left. This is the thickness of the vocal fold, and inflammatory cells infiltrate. And day 5, you see in some cases a hardened, scarred tissue. And that means no matter what, this cannot be, reversed. What about 4H&E, indicator of ROS? Day 1. At the early stage, ROS increases rapidly, and in the long run, you no longer see such a rapid appearance. And inflammatory cell infiltration, again, it also comes along with the ROS increase. At the initial stage, you have to really suppress the bad wound healing at the initial stage. What about astaxanthin in modifying the wound healing in the vocal folds? This is the same as a rat model. And are they before vocal fold injury? And day 5, astaxanthin was fed to one group and not fed to the other, and the other control had the olive oil. And this is what happened. This is hyaluronic acid. It's important in skin structure, but also in the vocal fold structure as well. Hyaluronic acid, it's rich in normal, but the sham, this is scarred tissue. With astaxanthin, you can retain hyaluronic acid to a certain extent. What's happening here? Gene expression in vocal folds has been discussed. Hyaluronic acid synthesizing enzyme was elevated, but it was not significantly elevated. What about the pro-collagen? Yes, it was a precursor of collagen. It was significantly elevated. What about basic fibroblast growth factor, BFGF? Perhaps with astaxanthin treatment, it was elevated significantly. It was confirmed. So, having that said, fibroblast cells, hyaluronic acids and collagens are produced by fibroblast cells, and astaxanthin may protect the fibroblasts so that the hyaluronic acid protection is maintained. And the basic FGF was upregulated so that hyaluronic acid would be protected in other channel. It was proven as well. So this overall would lead to the vocal folds maintenance. And what about the vocal abuse and the excessive loading? If you voice too much, then you get inflammation. If you continue that, you suffer from scar, and inflammatory cytokines would increase. So a singer like this is prone to such injuries. This is US-made rabbit model, and this is tracheotomy, and air is blown, and the vibration would be artificially induced for 1 hour, and the microprojection of the vocal fold surface will be damaged. And the harder the abuse is, the more significant loss you suffer from. So having that said, the actual human subject has been used in the clinical studies. The healthy male volunteer, 7 of them, were given vocal loading task, And with or without Xanthine treatment, what would happen to the vocal loads? And 80 dB decibel, 1 hour loud reading. You really have a hoarse voice. You have to speak very loudly in reading out. However, with 30 minutes rest, it would get reversed. So this is a reversible process. But anyway, this is vocal load. And 1 month, double the dose of normal is given. And another vocal loading test 1 month later. This is 20-year-old male without astaxanthin. The initial test. This is the phonation functions. Green is in the normal range. Immediately after the vocal loading work, red means you got the hoarse voice. But 30 minutes later, you regain the original state. With 1 month of astaxanthin treatment, it doesn't happen. 7 out of 7 showed this pattern. And sometimes you get more green in the post-load, so to speak. So this is a protective vocal load of vocal folds functions. This is before loading. This is ordinary voice, high frequency, yes. And after reading load, yes, it's not smooth. High range, you cannot really phonate. With astaxanthin treatment, voice quality do not change before and after loading. This is a statistical analysis of 7 subjects. As you can see, without astaxanthin, immediately after loading, it has a significant deterioration. With astaxanthin treatment, such perturbation do not occur. And vocal fatigue index is individuals' discomfort in phonation, so to speak. And immediately after and 30 minutes after, you still suffer from the fatigue, so to speak. But with astaxanthin treatment, it doesn't happen so much. Having that said, such functions or protective functions after astaxanthin seems to be very beneficial for the professional voice users. And of course, we doctors have to talk a lot. So one of the professional voice users, and I think we may enjoy the benefits of astaxanthin treatment, so to speak. And astaxanthin reduces ROS during vocal cord injury and maintain hyaluronic acid. Singers and professional voice users would benefit from astaxanthin. I'm a user of the astaxanthin for the past 5 years. Encouraged me to sing as a tenor, and I get the voice training nowadays. Thank you very much. Dr. Hirano, thank you very much for the presentation. I think I'm prompted to use astaxanthin because I'm a frequent speaker. One question from the floor, please, before we close the session with Dr. Hirano. Anyone with question? I have a question, by the way. Protective function, I understand. What about abused or injured vocal folds? Do you think it enhances recovery from the injury? As long as it is a reversible one, yes. But as long as it is irreversible condition, it'll be difficult to enjoy the benefit of it. What about before karaoke? Such an short, say, duration of onset of action is not expected. Well, you should constantly take it rather than to take it immediately after. Well, thank you very much. And this session will be provided by Dr. Professor Masamitsu Ichihashi from Kobe University School of Medicine. He's the expert of photo aging, and he studied at the Department of Dermatology at the London College. And currently, he's with the Saisei Mirai Clinic as a hospital director. Dr. Ichihashi, please take the floor. Thank you. Thank you. Good afternoon, everyone. We have a very pressed schedule, and I'm afraid we cannot take questions from the floor. Sorry about that.
Will be done by Dr. Sugino. And she will talk about the oxidation, stress inhibition, and the appearance change by astaxanthin. And you can see her CV on page 14. Thank you very much for your introduction. Well, in Tokyo, I have the clinic for the cosmetic surgery as well as the cosmetic treatment. And with a low invasion, we would like to improve the appearance. Of course, it is necessary to make a human being beautiful from the inside of the body. So not only the treatment from outside, but we have to change the food intake. So the also molecular medicine or the low carbohydrate food is the method. And with Facebook, we are talking about the smoothie. So please observe our Facebook. And let me start. As to the efficacy of the astaxanthin in the cosmetic area, it is used for the improvement of the dermis collagen and improvement of the spot and the wrinkles and the corneal layer water content. There are many reports with regard to that. However, there is no report which shows the difference of the skin appearance as a whole on the face. So we have selected a healthy female with a job who has potentially have the higher stress with their jobs. And we have used the oral astaxanthin and the lotion or the serum, astaxanthin serum for 3 months. And we have observed a change of the appearance and the oxidative stress and QOL. We have used 43 healthy volunteer females, and the astaxanthin 37, controlled 6, and average age is 49 and 46. And astaxanthin 12 milligram per day orally, and astaxanthin 0.09 containing a lotion 1 milliliter per day, and 2 times a day. And this is the items for the analysis. First, about the background of the patient, and the second is for the observation of the face appearance, and we have used a skin image analysis system called VISIA, and take the image with color and UV system and analyze the wrinkles and spots and spore, erythroplakin, and color shading. And also, we have measured the DLOM and BAC as an indicator for the oxidative stress. And for the subjective symptoms, we have added 5 questions with regard to the skin condition, in addition to the anti-aging QOL inquiry. And this is a schedule. And this shows the results. And first, about the analysis of the QOL anti-aging questionnaire, and the dropout smoker and admitted patients were excluded. As for the systemic symptoms, the myalgia, stiffness, low back pain, and arthralgia, weight gain, and diarrhea and constipation are improved. And for the skin symptoms, drooping of the tail of the eye and of the subdued color of the skin has been improved. And this is a graph which shows a difference, was a significant difference. And the skin condition has been also improved. And this shows a change of the oxidative stress value. And for the astaxanthin group, there is almost no change for the DRAM. However, the BAP and the modified ratio of the two tended to increase, but there was no significant difference. As to the skin image, I cannot advance this slide. Yes, thank you. And this is the skin image analysis system, VISIA. And the face was fixed, and it is possible to take a photo with reproducibility. And brown spot and pore and wrinkles and another 6 items are statistically studied. And on the right of the face, brown spot and pore number significantly reduced, and on the left side, pore number significantly reduced, but there are no other significant differences in other items. And this shows a change of the VISIA data changes. So the pore and the black spot were improved on the right, and for the left, the number of the pore has significantly improved. And this is VISIA data on the graph. So this is a change of the number for the pore, and the brown spots has improved. So I would like to show you the representative case. And case is a 46-year-old female with a visible ray. And this is what we can see. But when we look into the brown spots, and you can see actually the reduction in the brown spots left before and right after the administration. And the antioxidant marker modification ratio improved from 0.69 to 0.74. And this is for the hair pore. And on the right and on the left, the number of the pore decreased. Case 2, 51-year-old female, and this is with a visible ray. And when we focus on the brown spot, you can see the reduction in number. And there is no change for the antioxidant marker. And number 3, a 44-year-old female, right side and left side, the number of the pore has reduced. Number 4, 46-year-old female, a spot reduction. And please look at the number within this red circle. And the number of these spore also declined. And there is a decline for the antioxidant marker modified ratio. And left is the same. Left side is the same. The brown spot reduced, and the number of the pore also reduced. Statistically, there is no significant difference in terms of the wrinkle, but in case of number 5, case 5, the wrinkle has reduced significantly or clearly. And astaxanthin, if we can extend the period and if we can increase the number, there is a possibility that there will be the significant difference for the improvement of the wrinkle. This is a summary. With the oral administration of the astaxanthin, And there were two subjects who has the discomfort of the stomach. However, they can continue, and there is no abnormality for the skin, and they could continue for 3 months. So there is no safety issue. And the anti-aging QOL questionnaire and oxidative stress and the visual results were shown on this slide and discussion. With a subjective symptom, we could observe the various improvements, and it may be due to the improvement of the circulation and the antioxidation capacity of the astaxanthin. And also, we can see the improvement of the subjective symptom, and that may be due to the protection of the dermal layer from the singlet enzyme or the singlet oxygen by the astaxanthin, and also the elasticity can be improvement. And the antioxidative substance has increased in the serum. That may be the reason for the improvement of the oxidative stress. And for the spot improvement, and the astaxanthin can improve the melanin polymerization and antioxidation activity. And for the expansion of the pore and also the brown spot and wrinkle and drooping of the skin are the major problem for the females. However, there is no quite effective treatment method. And the major reason for the expansion of the pore is the inflammation of the unsaturated fatty acid within the cutaneous sebum. And we do not have any treatment so far. However, with the use of the astaxanthin, we can improve the thickness of the astaxanthin and also inhibit the parakeratosis. And also, with the use of the astaxanthin, we can improve the tone of the skin. And there is a difference between right and left for the improvement of the spots. Maybe it is due to how a UV ray is applied to the right or the left of the face, and also the baseline makeup differences. And this is a summary. And with astaxanthin, there is increased circulation, and it has quite a strong antioxidation capacity and collagen improvement. And this has improved the total condition of the patients. This is not a question, but and you have the shorter period of observation of the 3 months. But if you continue for the several years, the size of the spot becomes larger. And we would like to know whether we can inhibit enlargement of the spot by the use of the astaxanthin in your future study. Thank you very much.
Last speaker of this session, we have Dr. Jin Zuito, and he is the director of Jin Zuito Clinic, and he is going to talk about women's health and oxidative stress marker. And he graduated from University of Tokyo Medical School, and since 1997, he is running this clinic. So, Dr. Jin, if you are ready, please start the presentation. Thank you very much for your kind introduction. I am Jin, and I am the OBGY doctor. So in my area, how astaxanthin is used and what are the oxidative stress markers reactions are to be discussed. And menopausal women health and female hormones are gaining attention these years. And what kind of markers are used and what should we do to improve the situation will be discussed. And postmenopausal estrogen deficiency are quite obvious. And if the problems are obvious, it's easy to see. But 1/3 of the people will not have obvious problem. And how do we evaluate the reduction of estrogen for those cases? The estrogen effects on blood vessels are not known very well, so we have to study, and also action on the lipid metabolism. And what about the anti-oxidation? Those are the very important topic. And let me talk about the women's hormone. And the NO production is increased, and then the vasodilation will be done. And then LDL cholesterol production will be inhibited, and also the uptake of the cholesterol to the liver will be enhanced, and TG will be reduced. So if the female hormones are depleted, the women will be metabolic syndromes. And 130 patients, I have divided them into pre-menopausal and postmenopausal patients, and then studied the differences. And female hormones fluctuates. So I looked at the estradiol, and if it is around 67 pico, then they are classified into pre-menopausal women, and if it is around 15, they are classified into post-menopausal women. And still the other routes, the postmenopausal women have estradiol, so I set this as 15. And as you can see, the blood pressure is increased for postmenopausal women, and also LDL and TG as well. However, HDL cholesterol, for those groups, we didn't see any significant differences. And HbA1c and is deteriorated. And however, the high sensitive CRP, we didn't see any differences that I suspected. Probably postmenopausal women have a tendency of atherosclerosis because of the higher HbA1c, but this wasn't evident. And these are oxidative process stress markers, and the DROM is showing the oxidative stress, and the BAP is showing the anti-oxidative function. There were no differences between the groups. And since I looked at only those markers, I don't know whether there are differences in other biomarkers. But it was funny results. And then this is the effects of estrogen on blood vessels. The improved NO production and the inhibition of hepatic TG lipase, and a promotion of expression of LDL receptor, and the inhibition of activity and expression of LPL, therefore the disintegrating the LPL in the triglyceride into free fatty acid and glycerol, and also promoting synthesis of ApoA1I. And the probably antioxidant or the reactive oxygen species may increase after menopause. That was what I suspected. And also, therefore, I started to prescribe astaxanthin, and the 28 subjects who were compliant with the astaxanthin was studied then. And the age was around 56, and postmenopausal duration was 7.7 years. And then BMI, there are no differences, and diastolic and systolic blood pressures, there are no differences. And total cholesterol, TG, LDL cholesterol, high sensitive CRP, and hemoglobin A1C, there are no differences between those groups. However, the DROMs, the premenopausal group was 383, but the postmenopausal group was reduced down to 354 car unit. And the probably astaxanthin was working as antioxidant because the BAP was increased for the after astaxanthin started. And this is astaxanthin prescription study. And formulation, astaxanthin 12 milligram capsule, and administration once after dinner, and 12 weeks. And double-blind study, and the premenopausal to within 5 years after menopause are the subjects. And the slightly the high oxygen stress were included. And those are the endpoints: blood test and biochemistry and oxidative stress markers, and also the simplified menopausal index. And the oxidative stress markers included 8-OHDG as well, and also anti-aging QOL common questionnaire. On the left, this is control, and on the right, the astaxanthin group. The both had 15 patients and 14. Age, BMI, and the blood pressure are equivalent in two groups. Hepatic function, 14 test group, AST and ALT were significantly reduced, and gamma GT was also shown the reduction tendency. LDL cholesterol, HDL cholesterol, and TG, there were no difference between control and astaxanthin group. Then the female hormones and the ROS, what happens, and high sensitivity CRP, there are no difference, and other female hormones such as FASH and estradiol, no differences. DROMs and BAP and the 8-OHDG, there were no differences. The liver function was improved. Maybe the ROS was somewhat involved, but those outcome-wise, we didn't see any differences. And the simplified menopause index and QOL, there were no differences between two groups. And blurry eyes, the astaxanthin group was better than control. So objective indices, the hepatic function such as AST and ALT were improved with astaxanthin. Subjective index changes, only blurry eye improvement was seen with the test group. Even though within the normal range, the astaxanthin improved the ALT and ST AST. And postmenopausal women shows the tendency of metabolic syndromes. As you have seen the data, and metabolic syndrome in the liver, the fatty liver tendency was seen in the postmenopausal woman. So the liver function marker was improved with the astaxanthin group, and this means that astaxanthin is showing the possibility of hepatic protection. And what about estrogen? Estrogen improved the production of NO synthase, and also LDL cholesterol is reduced and HDL cholesterol is increased, and also we have the data for the prevention of non-alcoholic fatty liver diseases with the estrogen replacement therapy. But we have a problem with the estrogen replacement. The oral contraceptive is quite common in young women, and oral contraceptive increases the oxidative stress. And this was surprising to us. And also the internet shopping, everybody can buy different types of supplements, and Pueraria is one of them, and this is to help the indefinite complaints from menopause, and also this is used for young women to have firm breasts. And the Pueraria is used as supplement, but this is also increase the oxidative stress. And I saw the patients with the metrorrhagia, and then the P-ROM is about 200 or 250 is the normal range. However, the users of Pueraria D-ROM was increased to more than 500, so double the normal range. And I found that the Pueraria increases oxidative stress, and I asked them to stop. And then the first patient came to me every month, and then after stopping Pueraria, the D-ROM gradually decreased to the normal range. So supplements have to be carefully selected. And that was not estrogen, but the estrogen mimetic. And those estrogen and estrogen mimetic is related to oxidative stress. And I mentioned that only the reduction of female hormone does not change the oxidative stress markers. However, estrogen has antioxidant and pro-oxidant effects. Therefore, if the usage was not appropriate, it will lead to the increased oxidative stress. The time of menopause and the types of estrogen have to be carefully considered in order to avoid unwanted side effects in case of estrogen replacement therapy. This is the plump women. Well, now we see many of plumped women. After 50 years old, the women tend to put on weight. And therefore, you see more fatty liver with older women. So the liver function is lowered if they are over 50 years old. And they have to keep their appearance aesthetic, in order to maintain their appearance, the appropriate exercises and a balance between carbohydrates and the proteins have to be maintained, and vitamin and astaxanthin, and those are important for them. Thank you. Thank you very much, Dr. Chin. So for anti-aging, the food, diet, and exercise, and enjoy life. Those are the messages I gathered. And please accumulate the data for women. Thank you. That's all for this session. Thank you very much for your cooperation.
And next is the Healthy Aging for Loving Dog, to be presented by Dr. Murai by Kinder Care Animal Hospital. Please refer to the program for her CV. Dr. Murai. Thank you very much for your introduction. My name is Murai. Thank you very much for giving me this opportunity to make my presentation. We are using the astaxanthin supplement in animal health. Together with the human, the animals will have a more higher instance of the disease with aging. And this is the statistics by the Animcom, the insurance company. And skin, ear, and GI and eye are the major diseases with the aging. And one reason was a high instance of the skin disease is related with the structure of the epidermis, and its thickness is about 1/6 or 1/3 of the human epidermis. So it's quite delicate and quite weak for the external stimulation. So the hair coat is quite important for dogs. And because this is a case that epidermis is quite sensitive, this is molted 1 year and a half and non-castrated and has itching from the 3rd month and not been improved with more than 1 year treatment, and diagnosed at atopic dermatitis and steroid and antibiotics and antihistamine and shampoos and restricted diet were used for the treatment, and the Elizabeth's color was used for more than 1 year. So he was under the quite strong stress, and bottom skin was quite thin and inflammatory, and hair fallen for the back of the femoral and back of the dog. And although this dog is young, it is quite lean, so the nutrition is insufficient. And the barrier was failed because of the fragility of the skin. And this was diagnosed as a iatrogenic Cushing syndrome, and atrophy of the adrenal body was observed. And so the barrier was not working well. And with the skin, it is not possible to improve the itching of the skin. So the important point is to protect the skin. First, the epidermis should be protected to improve the barrier function so that we can improve the threshold for itching. So we use Vaseline and ointment, and the steroid has been reduced and stopped. And we have applied more the protein, animal protein, to improve the activity of the dog. And the dogs require much proteins in comparison to the human. Several times a larger amount of the protein is required. And also, or if the UV light is directly applied to the dog's skin, it may induce a further inflammation. So the dog should go out after the sun is set. And in order to improve the furthermore, we provided astaxanthin. And within 2 weeks, the inflammation has improved, and the condition has improved, and dog become more active. 1 month later, with good nutrition, the skin is better, and the hair growth started. And we use a low-dose laser for 1 to 2 times per week for 2 minutes, and the coat become quite rich. And with very good skin care and enough protein, and with a supplementation of the astaxanthin, and this dog was removed with a skin problem and has a very good hair coat and returned to the normal weight. Of course, there is no itching because of the allergy, and it is possible to go out during the daytime. Another case, a 6-year golden retriever, and the castrated, and this dog has a hypothyroidism, slightly fat, and no shiny hair, and the hair becomes shorter and less in number. These are the major complaints. As I mentioned, the epidermis is quite fragile for the dog, so if the hair is removed, then the inflammation occurs and infection can occur. As a treatment, first, the hormone was supplemented, and they prevent from the drying. And in order to prevent for the oxidative stress for the damage, astaxanthin was administered. And with the control of the symptom, the hair becomes better. Of course, the aging occurs, but the hair condition has improved. And astaxanthin is quite important for the preventing the deterioration of the hair condition. This is a diabetes dog, 3.8 kilogram dog, quite lean, and with 11 year. This dog becomes the diabetic. However, it is well controlled, and the heart failure occurred at age 13, and the diabetes was well controlled. So the aging, of course, goes, and the number of the disease increase, but with astaxanthin, the body weight increases and becomes more active, and hair concentration is greater and less trouble with the skin. And when we look at the carpal joint, you can see the muscle strength is better. This is the age-related incidence of the dog's diseases, and eye disease and circulating organ disease and liver and bile tract disease increases with middle age, and ear disease also increases with age. However, for the ulcers and it increases with age. And endocrinology, the incidence is higher after 8 years, and especially the hypothyroidism or adrenal cortex hypofunctioning and diabetes is high. And for the senior dogs, so these are the hypothyroidism, hyperadrenocorticism, diabetes mellitus, cancer, and also the heart diseases are the major diseases which occur at the older dogs. And because of these baseline diseases, it may influence the skin condition, and that will lead to the reduction of the the hair number as well as the condition. And it may lead to the inflammation as well as itching and other senior skin diseases. So for the senior dogs, it is important to protect the barrier function of the skin. And for I make 4 advices for foods, you have to provide a good, balanced feed for the dogs, and also for the going out. And you have to go to the doctors regularly. And thirdly, you have to get the inspection of the dog, and also you have to consider the ROS for this patient, and it is better to provide the supplement as astaxanthin every day, which has a very good antioxidative activity. Thank you very much. Dr. Murai, thank you very much for your presentation.
Thank you very much. And last but not least, the sponsor of this symposium, Asterial CEO President Mitsunori Nishida, to say a few words of closing. President Nishida, please. My great gratitude goes to all of the speakers of the day to share with us your valuable latest research results. Thank you very much. And also all of you in this room, thank you very much for staying with us until the very end of the symposium. And I sincerely hope that this symposium deepen your understanding for the potentiality of the natural astaxanthin, and also became a trigger for you to use it for preemptive therapies you provide. We were the first company in the world to successfully commercialize the natural astaxanthin, and since then, more than 20 years, we have been working with this rare natural product. This is the king of carotenoid. This is not only another antioxidant. Its strong antioxidant effects on reactive oxygen species and unique physiological activities are not found in other antioxidants. Therefore, it has many potentialities. People accumulate fatigue and stress, and they induce excessive ROS and inflammation. In turn, it will lead to lifestyle-related diseases such as diabetes and dementia. Prevention is the best treatment, but it's easier said than done. There are many research results showing that natural astaxanthin will inhibit inflammation caused by excessive ROS and prevents chronic diseases such as lifestyle diseases. Therefore, natural astaxanthin is an ultimate biophylactic substance, and it is the key to the preventive and preemptive therapies. Through this symposium, I sincerely hope that you understand deeply about their capabilities. And we will continue to elucidate the potentialities of astaxanthin so that we can further continue R&D of the product and deliver natural products as many people as possible in the world. And I hope you will continue to loyal to Fuji Kagaku Group and Asterial. Thank you very much for your support. Thank you very much, Mr. Nishida. And I hope you deepen your understanding about the potentiality of astaxanthin. And I sincerely hope that we will be seeing you again next year, next symposium. Thank you.